This afternoon, like I promised this morning, teaching about acne scars and the treatment for scars. You already saw me doing a radiofrequency helium plasma treatment in the operating room. That's a much more severe type of resurfacing for someone with lighter skin tone. Now we have a patient that's a little bit younger who has very healthy collagen producing skin but has some scars, but he's also what we consider what is called a darker skin type, where we pre-treat the skin using a lightening peel and lightening creams before. Turn your head all the way to the left. There you go. And then we planned to do a stronger treatment like we're going to do today, which is laser resurfacing. What we have to do first is numb the area. We've already done topical numbing. You could see it on his skin. If any comments are made, make sure you guys tell me.
Okay.
We've done topical numbing. We also gave him some medications. Men are always find this to be the most challenging. You can go to sleep for these type of treatments, but it's not worth it. It's a lot more downtime. It's medicines. I just think it's easier to just kind of bear and grin the pain and the numbing medicine, and then once it's in, very minimal pain. So this is the hardest part because he's going through this stuff right now, which burns a little bit. He's doing great. It's too long now. And we're going to do some major nerve blocks. So I like to teach a little bit about this. There's a nerve that's in the temple area, turn all the way, that numbs about the lateral part of the face. So you're going to feel a little pinch. We go all the way down into the lateral part, and we inject in there, and that will numb this lateral part. Not 100%, but it does pretty significantly, and that will help.
Which procedures do you do nerve blocks for besides CO2?
Whoever wants it. You know, typically we do that. You could do it for Fraxel or Fractora, but in general it's mostly just CO2. Erbium doesn't really hurt that much. Turn your head to the left. There you go. We're doing that same nerve block on the other side, going all the way down. And really, if anyone wanted it, we could do it for anything. It's just not necessary.
Would you do it for plasma?
Oh yeah, for plasma is a different story. You have to do both nerve blocks and tumescent anesthesia, which is injecting numbing in the entire face. If you don't do that, it's too excruciating, and even then, the person would have to go to sleep. Open your mouth slightly. So the next nerve block we're going to do just like you go to a dentist. You're going to feel a little baby pinch. 1, 2, 3 right there. Good. And then it numbs the lower part, the lower lateral left part of his face. And I usually do a little extra numbing here because this is a very significant area for where scars are, where people feel.
How long does this numbing sensation last?
2 to 3 hours. But interestingly, the tissue itself will stay pain-free for even longer than that. Little pinch. Doing great. There you go. So it's really important, in my opinion, to really make the comfort as much as possible. Lasers increase the amount of heat in the skin, so even right now he might not feel as much, but later he could get that sunburn type effect, when you go in the sun and then later it's like very painful a couple hours later. That's what can happen with lasers, so the numbing in here helps prevent that. Open it for me. Good. A little pinch. 1, 2, 3. Great. We're just going to numb now the middle face with the infraorbital nerve, which is right here, where my thumb is, feeling right where it's being injected. Great. Opening down a little bit.
We're doing a CO2, but right now we're doing nerve blocks.
So yeah, this is nerve block preparation for a CO2 laser resurfacing. I'm just wanting to show you guys all the components each step of this procedure. How we do it is we do this nerve block, then we reapply numbing medicine, give an injection of pain medicine, and then we let him rest for 10 minutes, and then we typically start. Good. Yes. Thank you. Now we're going to do a couple injections around your mouth, so take a deep breath in, breathe all the way out. Good. Deep breath in and do another one by your nose. This is a little more sensitive. This helps numb part of the nose and lip.
I actually don't feel that one at all.
Well, that's good. So we're starting, the nerve blocks are starting to work. It's really good. It's amazing with science. Could you imagine doing this in 100 years ago? It'd be a punch in the face. And that's what you would get to do a nerve. I also like to add a little bit extra so we feel for that foramina, and we just go down and add a little bit more superficially to another CC right there. I do also one directly in the middle of the chin. This one he'll feel a little bit because the nerves don't go fully right there. So this helps for that little middle of the chin area. And then we do another one right directly into that nerve here. And then we're gonna do one more short under his eye area. That's a long, yeah, I mean a short one, please.
Wait, does it swell my face?
What'd you say?
Like, does it swell my
Oh yeah, it makes a
Oh.
lot of fluid in the face. You're gonna feel really swollen. We're gonna go right by the eye area all the way down to the bone. Just give a little bit in that area there. It's gonna feel like his eyes are a little heavy. Good.
Wait,
I also-
did you just go in? I didn't feel that at all.
Good.
That's good.
Do another
Doing good.
injection around the edge of his eye because we're gonna get real close to that area. And then another one where, again, we feel right for that foramina, go right down into there. I'll give a little bit extra numbing there. Now we're gonna do the nose. Is it short?
Yes.
Now we're gonna do the nose and he'll be ready to go. So we're gonna do a little pinch in the middle, which you'll probably feel slightly, just to bleb up a little bit of the nose area. We're gonna do another pinch directly on the nose, right in the middle. That does the dorsal nasal nerve, which will go to the majority of the nose. And then this one hurts a little, so deep breath in, breathe all the way out. Beautiful, good. Great. Let's do, and I always check, see, did you feel any of that? Good. No feel, anything there? Good. So do a little pinch here. Another one on that side, because that area is the hardest area to numb. And then he's ready to be re-numbed and to get medicine. So now he's gonna start, you can tell he's comfortable, wasn't the best thing in the world, but now he's ready for the laser procedure.